In drug development, impurity data often feels reassuring. The more data we collect, the safer we think we are. More peaks, more tables, more studies. But that intuition is often wrong, and sometimes it works directly against good decisions. In many development programs, collecting more impurity data too early does not reduce risk. Instead, it increases uncertainty. It makes decisions slower, harder to justify, and more difficult to explain later. Teams over-collect impurity data for understandable reasons. They want certainty. They want to anticipate regulatory questions, and they want to avoid surprises later in development. The intention is good, but the outcome often isn't. Why? Because early impurity data is rarely stable. Processes are still changing. Formulations are evolving, and analytical methods are still being improved. That means today's impurity profile is often not representative of what the program will ultimately see. ATT's stage small peaks and variability often reflect noise, not true safety risk. Treating every detectable signal as meaningful creates confusion rather than insight. And when this immature impurity data is overinterpreted, teams start building narratives. They create stories about origins, mechanisms, and long-term significance. Those narratives feel convincing, but many of them do not survive further development. So what happens downstream? Later, when processes improve or methods change, those early narratives often collapse. That leads to comparability questions, internal debates about data credibility, and uncomfortable regulatory discussions that could have been avoided. This is a huge, self-inflicted wound for many programs. This brings us to the real purpose of early impurity data. It is not to close every single question right away. It is to identify what might matter later. It helps teams decide where to focus their attention as the process and the control strategy evolve over time. So, better early questions sound different. Instead of asking, "What is everything?" we should be asking, "Are there structurally concerning species present? Do impurity levels appear roughly stable, or are they trending in a worrying direction? And is there anything here that could plausibly impact safety as development progresses?" The controls you set should reflect this mindset. Early impurity controls should be fit for purpose. They should be directional, science-based, and flexible. Most importantly, they should be designed to evolve as the process matures, not lock teams into early assumptions based on incomplete information. Overdefining impurity limits too early comes at a real cost. It reduces flexibility. It increases the cost of change, and it forces teams to defend decisions based on immature data that was never meant to be final. This is where leadership and judgment are critical. Strong analytical leadership knows when to stop collecting data and start interpreting it responsibly. Judgment matters. Restraint matters. And knowing what not to define yet is just as important as knowing what to measure. Ultimately, impurity data should support decisions, not overwhelm them. Clarity is more valuable than volume. Understanding is more useful than exhaustive enumeration at the wrong stage of development. So, here's the key takeaway. In early development, the goal is not to eliminate all uncertainty. That's impossible. The goal is to understand which uncertainties matter, which can safely wait, and how that understanding should evolve over time as you learn more about your product and process. In the next video, I'll talk about specification setting, why it is not a math exercise, and how poorly designed specifications quietly create risk later in development. Thanks for watching, and I'll see you in the next one.